I brought my son to the clinic for his weekly insulin injection when the new doctor looked at his chart and said, "This child has never had diabetes." The syringe was already in Dr. Holloway's hand when she froze, staring at the computer screen like it had just shown her something obscene. My son Liam sat on the examination table swinging his legs, used to this routine after 3 years of weekly visits. He was humming some cartoon theme song, completely unaware that the doctor's face had gone pale. She set the syringe down with a hand that trembled slightly and turned to face me with an expression I couldn't read. "Mr. Garrett, I need to ask you something important. Who diagnosed your son with type 1 diabetes?" The question felt wrong, off balance, like asking who diagnosed the sky is blue. "Dr. Pemberton," I said. "He's been Liam's endocrinologist since the diagnosis 3 years ago." "Why? Is something wrong with the insulin?" Dr. Holloway shook her head slowly, still staring at the screen. She clicked through several pages of medical records, her jaw tightening with each screen. "Dr. Pemberton is on medical leave, which is why I'm covering his patients this month. But I'm looking at Liam's file, and something doesn't make sense. There's no initial diagnosis report, no glucose tolerance test results, no A1C readings from 3 years ago, just a note saying type 1 diabetes and a prescription for insulin that's been refilled every week since then." My stomach dropped. "That's impossible. We did all those tests. Liam was in the hospital for 2 days when he was diagnosed. They ran blood work constantly. They said his pancreas wasn't producing insulin anymore, and he'd need injections for the rest of his life." Dr. Holloway turned the screen toward me. "I'm not seeing any hospitalization records from 3 years ago. I'm not seeing any diagnostic tests at all." Liam looked between us, sensing the tension even if he didn't understand it. "Dad, am I getting my shot or not? My arm's getting tired." I put a hand on his shoulder, trying to keep my voice steady. "Just a minute, buddy. The doctor needs to check something first." Dr. Holloway pulled out her phone and stepped into the hallway, speaking in low, urgent tones to someone I couldn't hear. When she came back, her expression was grim. "I've ordered an immediate glucose screening and full metabolic panel. If Liam actually has diabetes, his blood sugar should be elevated right now since he hasn't had insulin in a week, correct?" I nodded, my throat tight. "He usually gets shaky and dizzy if we miss a dose. Last week we were late getting here and he started feeling sick in the car." Dr. Holloway made a note of this but didn't comment. She took Liam's blood herself, filling several vials while humming along with his cartoon song to keep him calm. The lab results came back in 20 minutes because Dr. Holloway marked them as urgent. She looked at the printout for a long moment before meeting my eyes. "Liam's blood glucose is 94. That's completely normal. His A1C is 5.1, which indicates no diabetes whatsoever. His pancreas is functioning perfectly." The room tilted. I grabbed the edge of the examination table to steady myself. "That's not possible. He has diabetes. He's had it for 3 years. We give him insulin every week. We monitor his diet. We check for symptoms constantly. You're telling me none of that was real?" Dr. Holloway's voice was careful, professional, but I could hear the anger underneath. "I'm telling you that right now, at this moment, your son shows no signs of diabetes, which means either he's been miraculously cured or the diagnosis was wrong from the beginning." Liam tugged my sleeve. "Dad, you're squeezing my shoulder too hard." I loosened my grip, barely feeling my own hands. "If he doesn't have diabetes, then what's been happening for 3 years? Why does he get sick when we miss appointments? Why did Dr. Pemberton say he needed insulin?" Dr. Holloway chose her words carefully. "I need to ask you something difficult. When Liam gets his insulin injections, who administers them?" I blinked at the obvious question. "Dr. Pemberton does. Every week. That's why we come here. He said the dosage was too precise to trust to home administration, especially with a child this young." Dr. Holloway's expression darkened. "That's highly unusual. Most type 1 diabetic children are taught to self-administer, or their parents are trained to do it at home. Weekly clinic visits for insulin would be extremely inefficient and costly. Why would he insist on that arrangement?" The question hung in the air like smoke. I had no answer. Dr. Holloway made another call, this time not bothering to leave the room. "Yes, this is Dr. Holloway at Riverside Pediatric Clinic. I need to speak to someone about Dr. Pemberton's medical leave immediately. This is urgent." She listened for a moment. "I understand he's on leave. I need to know why he's on leave." Another pause. "I'm his covering physician, and I've discovered a potential medical ethics violation. I need information now." Her tone left no room for argument. She waited while whoever was on the other end made calls or checked records. Finally, she spoke again. "When did this investigation begin?" "I see. And has law enforcement been notified?" My blood ran cold. Law enforcement, investigation. Those words didn't belong in a conversation about my son's doctor. That's when things got out of